Recent studies show that when cholesterol goes down, heart health doesn't necessarily go up. Some say we need to focus on more than just lowering cholesterol. And Dr. Harlan Krumholz is a professor of cardiology at the Yale School of Medicine. Good morning, doctor.
Good morning.
So everybody thinks that when it comes to heart health, the most important thing you can do is lower your cholesterol. Are you saying that's not necessarily so?
Well, there are a lot of things that are important, and cholesterol remains very important, but there's some new things happening. We're moving from an emphasis on these targets to more of a focus on risk and how best to lower risk, and they don't always go together. This, I think, came to us as we saw that the drugs you choose to lower cholesterol may not always lower risk, and so we have to pay attention to what actually is happening with risk.
So the point being that the target we're all given when we go to the doctors, we got to get your all these cholesterol levels down. But you're saying that the drugs that do that aren't lowering our risk at all?
Well, the level of evidence is different for different drugs, and the idea here is that we need to select the drugs that lower cholesterol and lower the risk. Look, the point is making you safe. The point's not just making your lab tests look good. And the point is that statins first and foremost, we know lower cholesterol and save lives. There are other drugs that lower cholesterol, and we have yet to determine their effect on whether they save lives. And then there are others that are still sort of in experimental testing where we're going to hope to find that out. But my point is that, and I think the point of the American College of Cardiology, American Heart Association, the new guidelines, is to focus on the strategies that lower cholesterol that we know and can be confident about lowering risk.
So how do you determine whether your risk is being lowered if you're not looking at those numbers?
Well, right. So first and foremost, again, it's important for people to focus on whether the risk is high enough that it's worth being treated. If you're very low risk, there's not much we can do to help you. If you're high risk, then it's really worth it to be treated. There are risk calculators. You can Google CVD risk calculator and find some of these and get an idea of what your general risk is. And then if your risk is high enough, then, well, lifestyle intervention should always be first. But if it remains high, then we talk about drugs. And the first line drugs need to be drugs that have been tested to show not just to lower your cholesterol, but to lower your risk, make you safer.
Are doctors prescribing those drugs?
Well, doctors are prescribing the statins in great numbers, but there are also other drugs that get prescribed that help you reach your target, that make people feel better, but for which we're still not sure whether or not they lower your risk. And so these need to go to the back of the line. I mean, they really are not yet shown whether or not you have a net benefit, whether it is something that will reduce your risk of heart attacks. In fact, in some of these drugs, if you look at the small print on the ads, it says, not yet shown whether this drug prevents heart attacks or improves survival. And I think it's important for people to know that there's a difference in the level of evidence that's available.
All right, Dr. Harlan Krumholz, good advice. Thank you very much for being with us this Memorial Day.